What actually happens in heart failure? Yes, we know that heart failure is the inability of the heart to pump blood effectively, but what actually happens? How do these symptoms, the leg swelling, the neck swelling, how do these symptoms come about? Today, we're going to be looking at the disease process of heart failure. After this video, you'll not only understand how it happens, but you will understand why it happens. For us to know what happens when the heart fails, we have to know the normal function of the heart. What does the heart do in its normal condition? And for us to know that, let's look at the physiology. The heart pumps blood. Now, the amount of blood the heart pumps out each minute is what we call the cardiac output. So, cardiac output is anywhere between 4 to 8 liters every minute. It means that the heart has to pump between 4 to 8 liters of blood every minute. Once this output is maintained within these ranges, everything is balanced. Blood flows to the organs, gives nutrients and oxygen, brings back waste, everything is in sync. Now, in heart failure, the heart is not able to pump as effectively. If something is not putting in the same effort as it used to, the result will drop. It is the same thing that happens in heart failure, either because the heart muscles are too weak or that the heart is too stiff, that it cannot stretch properly to accommodate blood, or that the heart has been damaged by things like a heart attack or atherosclerosis. Regardless of what caused it, the result is the same. It causes a drop in the cardiac output, which means the amount of blood that the heart is pumping is no longer enough to meet the demands of the tissues or the organs. That is one. Two, it also means a drop in blood pressure. Once there is reduction in cardiac output, the blood pressure drops. This is very well explained in our blood pressure series, part 1, where we see how the blood pressure is directly affected by cardiac output and vascular resistance. So once the cardiac output is raised, blood pressure is raised. Once the cardiac output reduces, blood pressure reduces as well. Now, the organs of the body, especially the brain and the kidneys, are very sensitive to changes in blood pressure. Once the blood pressure drops, they interpret this as an emergency and trigger survival mechanisms. The first of these to be activated is the sympathetic nervous system. It activates the fight or flight response. And what this does is it increases the heart rate, it increases vasoconstriction, and it increases the contractility of the heart. In the short term, they raise cardiac output and vascular resistance, increasing blood pressure. But in the long term, they place more work on the already failing heart. The heart is already weak and they are just overworking it. Secondly, the kidneys pick this up and attempt to rectify it. You remember when we said that the cardiac output is the amount of blood that the heart pumps out in each minute. Now the kidneys now see there's a reduction in cardiac output. That means the amount of blood in the body entirely is not enough. So we need to do things to increase the amount of blood so that the heart can pump out more. So the kidneys now retain sodium and water. Retention of sodium and water causes increase in the blood volume. Unfortunately, this also stresses the heart even further because the heart now has a lot more blood volume with less strength to pump it out. Now there is now an excess of blood volume, so the ventricles stretch to try and accommodate all this blood. This stretching changes the structure of the heart. They become overstretched. Their structure changes because they're trying to accommodate all this blood. The more it stretches, the more strain it puts on the heart, and the more the heart continues to fail. So now there is so much volume, and the heart cannot pump out all this blood it has. Blood starts to pull up in the heart and starts backing up to where it came from. When it's in the left ventricle, normally the left ventricle will collect oxygenated blood from the left atrium, which comes from the pulmonary vein. In this case of heart failure, the left ventricle is not able to pump out all the blood. So blood starts to pool. The remaining will pool in the left ventricle. It will remain there. And because it's more than it normally is, it will start to flow back into the lungs. This increases the pressure in the lungs and causes the fluid to leak into the lungs tissue. As it's leaking into the lungs tissue, that is now what triggers the shortness of breath, the coughing. You will see most of these patients complaining that they feel like they can't get enough air, like they're drowning. And that's because the lungs tissue is literally filled with fluid because of the rise in pressure caused by the backflow of blood. When this is in the right side of the heart, the right ventricle normally would collect blood, deoxygenated blood from the superior and inferior vena cava and send it to the lungs via the pulmonary artery. In heart failure, the right ventricles will be unable to pump the blood to the pulmonary artery. So that means the blood starts to back up into the superior vena cava and subsequently the system. Fluid will now start to leak from the blood vessels into the tissues and you start to see leg edema. It would also leak from the blood vessels and then you start to see neck swelling from jugular vein distension. Now take a step back and try to look at the full picture. First, the heart fails. Then the body tries to compensate. This compensation worsens the heart failure, leading to fluid overload and congestion, further worsening the heart failure because these mechanisms put strain on the already weak heart. As the heart failure is being worsened, the body keeps trying to compensate, creating more fluid overload and more congestion. You can see how this connects to the symptoms. Once fluid leaks into the lungs, it causes shortness of breath. The lungs is also trying to expel this fluid, so the patient continues to have a cough. We sometimes call this cough a cardiac cough because it comes from the heart failure. It is caused by a cardiac reason. The fluid being backed up into the veins leads to it leaking out into the body tissues, and that is usually evidenced by edema of the legs, which is leg swelling. When there is excess of this fluid in the veins, it causes the veins to get distended, which we normally see as a swelling on the neck, jugular vein distension. So you can see how everything connects. Nothing is in isolation. They are all related. The treatment is to interrupt this vicious cycle. Diuretics remove excess water in the body, leading to a reduction in blood volume. ACEIs, which are angiotensin converting enzyme inhibitors, focus on the kidney level and stops the kidney from retaining water and sodium, thereby reducing blood volume. Beta blockers reduce the workload of the heart. Every single one of these things reduce the strain on the heart, causing the heart to be able to manage its pumping action a lot better. In summary, I want you to think of pluck each time you hear heart failure. First of all, the pump fails, which is the heart, leading to a low cardiac output. The body tries to compensate for this cardiac output by retaining sodium and water as well as the sympathetic nervous system. This instead overworks the heart, leading to more failure and causes blood to back up, causing congestion. This congestion now leads to symptoms such as leg edema, neck swelling, pulmonary edema, and shortness of breath. That is simply the disease process and how heart failure occurs. If this video helped you to understand heart failure, let me know in the comment section below. Don't forget to like and subscribe. Share this video to a fellow colleague who might be struggling to understand heart failure. If you're currently studying the cardiovascular system and you have a topic that you're struggling with that you would like me to simplify for you, just let me know in the comment section and I will do that for you. Take a look at other videos on the channel as well. We're currently on the cardiovascular system and we're doing each topic as a series to be able to break this down into little chunks so that you can understand better. Let me know if these videos are helping you. Thank you so much for joining in today. In the next lesson, we will be talking about the differences between right-sided heart failure and left-sided heart failure. I hope you look forward to this lesson, and I hope I see you there.